COVID-19 cases have dropped. South Africans have been cautioned that a fourth wave will hit the country in the next few weeks.
Our national team is working with provincial teams to prepare for the inevitable fourth wave, but we have to do everything possible to make sure that we can delay it and make sure even when it comes, it must have far less impact. The health facilities readiness in preparation for the fourth wave is addressing areas such as availability of oxygen supply, of which our bulk supplier, which is Afrox, has already finalized contingency plans for making sure that when the fourth wave does come, we do have enough supply of oxygen. Other areas such as bed capacity, also equipment, and also such as ventilators and other equipment, the personal protective equipment, and also other consumables, all these are receiving attention to make sure that we'll be ready, which is expected somewhere in the middle of December or late December or even January.
Despite Phaahla's confidence of his department's preparations for the inevitable fourth wave, he cites staffing solutions as a challenge.
As a challenge is a retention of staff. As many of our additional staff employed for the COVID have been employed on short-term contracts. So this is a major area which we are also discussing with our National Treasury colleagues to make sure that we can receive additional funding to make sure we can retain the staff who are making sure that we can have enough capacity to look after the patients.
And with staffing problems that will hopefully be resolved with the assistance of Treasury, for South Africans intending to travel abroad, Phaahla says there will be negotiations with other countries to accept vaccination certificates.
Countries have to first reach an agreement on recognizing each other's certificates. So because this is still new and developing, even from our side, we had not yet even started to negotiate with many countries because of the fact that we, as we said when we launched the certificate, that it still needed a lot of improvements. So as I mentioned this morning, one of those improvements have already been achieved in terms of activating the safety of the QR code, which can now be scanned and verify information. But there is furthermore security features which will be enhanced during the course of this month. So as those security features get improved, we will be negotiating. We have already also been approached by some countries to recognize their certificates.
The department also raised concerns about the low number of vaccinations in the 18 to 34-year-old age group. Despite this, it's confident that by Monday, 40% of the adult population will have at least received one vaccination dose. Phaahla, SABC News, Johannesburg.